Hello, my name is Dr. Mel Taylor. I'm a psychologist based at Macquarie University, and I've conducted a number of research projects with horse owners around their approach to risk, and more recently, their approach to risk in relation to Hendra virus. As you will already have heard, Hendra virus is transferred by flying foxes to horses and then onto people. Flying foxes are attracted by fruiting and flowering trees, as well as native plants. In particular, they like figs and mangoes, and these are also the sorts of trees that horse owners like to plant around their paddocks. And therefore, this increases the chances that flying foxes and horses will come into contact with each other. In order to reduce the risk of Hendra virus, horse owners are asked to perform a number of different practices to reduce the likelihood that horses will become infected. I've been asked to talk to you about the sorts of recommendations that are made by authorities to horse owners to reduce this risk. The list you can see there, I'm not expecting you to read it all. I'm going to go through some of these behaviours, but I just wanted to tell you that mostly there's quite a consistent list now of recommendations that are suggested by state agricultural departments and federal agriculture department, or the veterinarians, and also peak bodies for the horse industry and horse associations. So this is a fairly consistent list of recommended behaviours that horse owners are asked to consider doing to reduce that risk. So I'm going to divide this into three different sections and talk about the actual behaviours that are recommended, but also then talk about the strengths and weaknesses of these recommendations from the perspective of horse owners. So before I go any further, I would like just to take a moment to talk a little bit about the horse industry and about horse owners generally. I think it's really important to appreciate that the horse industry is quite complex and that people are very different. So in this domain, you have everybody from recreational riders with one or two ponies that they like to sort of ride for pleasure, through to equestrians and people that do eventing and travel a lot with their horses. You get thoroughbred racing studs and people who have their income that depends on the horses, and you have horses that are working horses. So quite a different sort of set of roles that horses have, and people have very different relationships with those horses, from pets to working sort of animals through to that commercial sort of interest. And I guess this is important because there's lots of different levels of affordability in this area as well. So not everybody necessarily has got a lot of money and can afford to have vaccinations, and some of the recommendations perhaps aren't as practical or as affordable for some people as they might be for others, and it's just worth keeping that in mind as we go on. So in terms of these behavioural interventions, the first set I've termed property management and horse husbandry. So with these interventions, I've broken this down into the requirements for people who can move their horses out of paddocks and those that can't. All these recommendations are really about trying to keep horses away from underneath trees for fairly obvious reasons. So, flying foxes will land in trees, they may eat there, they may rest there, and of course they may defecate and urinate, and of course they can drop fruit that is covered with saliva that horses might pick up and eat. So keeping horses away from trees is one of the key sort of aspects of intervention that are recommended. So if you can remove your horses from paddocks, the recommendations are that whilst trees are in fruit, or if you have trees that are attractive to flying foxes, that it's best to keep those horses away from those trees. And if you have these sorts of trees, you might want to remove your horses from around the area at dawn and dusk when the flying foxes are active, when they're sort of foraging or flying over your property. If you don't have the option of removing your horses from paddocks, perhaps you don't have the space, the options there are really about fencing off trees. So in the photograph you can see that that's a permanent sort of fencing solution, or you can use more temporary fencing solutions to, again, keep horses away from that sort of area under trees. They also recommend you clear up fruit debris for the reasons I've just said, and of course there are other options such as actually taking down the trees, removing the trees or certain shrubs. Other horse husbandry recommendations include taking food and water away from under trees, in particular, making sure that feed and water containers have got some sort of cover or shelter over them, again to reduce the chances of there being any contamination from above from flying foxes who may be resting in those trees. So as you can see, these recommendations are fairly straightforward and practical. It's quite clear why they would be effective in terms of reducing risk of Hendra virus. Unfortunately, there are some sort of concerns around these recommendations being sort of time consuming, obviously taking horses in and out of paddocks daily, clearing up, etc. It can be expensive in terms of replacing fencing or cutting down trees, and it can just be impractical for some people for their lifestyles. So the uptake of these behaviours tends to be fairly low. We've got data around sort of 20% or so of people only are doing this sort of thing. And of course, some of these recommendations are unattractive in general. So people move to the country for the surroundings, and losing all their trees is not something that perhaps is an acceptable approach. And some recommendations aren't possible. So if you see the picture on the left there, if you have a property with a large dam with water in it, and you have trees around it, clearly it's not possible to put any sort of shelter over that. So some people think that if you can't do the whole thing, that you're leaving risk there, and why bother with the other things as well. So uptake is generally a little bit patchy in this area. This second set of behaviours and interventions that I'm going to talk about, I've named horse health and infection control. So as you will already have heard, the diagnosis of Hendra virus is quite tricky because the symptoms are not necessarily specific. So if you have a sick horse, it's really important that you treat it as though it could perhaps be Hendra virus, especially if you live somewhere where Hendra virus incidents have occurred. So in this list, you can see that these behaviours are really what you might term general infection control, or might be regarded as sort of best practice behaviours in terms of infection control. So things like isolating sick horses, using PPE, personal protective equipment like gloves, for example, when handling sick horses, reducing the possibility of transfer of disease from one horse to another off your property through visiting practitioners, and generally cleaning equipment. Those sorts of things are very important. And you may also have heard that the virus, Hendra virus, is actually quite fragile, so it's quite easy to kill with soap and water and sunlight. So these sorts of behaviours would be very effective for Hendra virus. And of course, the important other thing is, if you have a sick horse, it's important to get some veterinary advice. When it comes to some of the weaknesses, they're similar to before, that people can regard these practices as being unnecessary, taking a lot of time, perhaps costing more money in terms of cleaning and PPE equipment, gloves, etc. And it may be, they may consider it to be impractical for whatever reason. The other thing is these sorts of practices require the horse owner to remain vigilant and to keep a close eye on horses generally, to check and pick up those signs of sickness early on. And of course, they rely on a willingness of a horse owner to contact a vet when they suspect something that could be Hendra virus. And of course, that depends on both having a good relationship with a vet to start with, but also having a willingness to report Hendra virus, which, as you can imagine, if you have a case of Hendra virus on your property, it has lots of ramifications for you as a business. You'll go into quarantine, and you'll have people walking on your property, and for a number of reasons, some people don't want to bring external people, especially not council and government, onto their properties, and so there is some unwillingness to report other diseases, and there's no reason to suspect that Hendra virus would be any different in terms of people's willingness to report it. The final section about behavioural interventions is around vaccination. So horse owners are recommended to vaccinate their horses for Hendra virus. There is no human vaccination, so this is a vaccination for horses. And the quote you can see there on the screen is really the wording that is used most frequently by government departments, veterinarians and associations in relation to vaccination. So it's regarded as the single most effective way of reducing the risk of Hendra virus infection in horses. Vaccination isn't mandatory. So it's something that horse owners have a choice about whether they vaccinate or not. And of course, the advantage of vaccinating a horse here is that, of course, you protect the horse, but the other aspect is, of course, as soon as the horse is protected, that also stops the opportunity for the virus to spread to people. So by vaccinating your horse, you're also protecting yourself, your family, and other people that come into contact with your horse. So, as I say, vaccine isn't compulsory in a general sense, not mandatory across the country or anything. But if you belong to certain associations or you take part in certain events, they may have a requirement for vaccination. So, if you take your horse to the Ekka in Queensland, the big show, you have to have a Hendra virus vaccination up to date with your horses. And if you compete in certain competitions, there is often a requirement for horses coming from certain areas or horses staying overnight at an event to have Hendra virus vaccination. So there's no consistency there, but there is, increasingly there's requirements to have vaccination. So I wanted to give you a little bit of information here about the vaccination and the timelines and the way it's administered. So the vaccine was developed and released in November 2012. And so it's been around for about 5 years. It was initially issued under a minor use permit, and all that really means is that there were special conditions about how it was to be used, and that was partly due to them wanting to release it early so that they could use it as quickly as possible. Initially, horses need 2 vaccinations around 12 weeks apart, and when the vaccine first came out, it was required to be re-administered as a booster every 6 months. And that went on until May 2016, and now it's an annual vaccine, but you still have to have those initial 2 vaccinations. The vaccination has to be given by a vet, and this is a bit different from other vaccinations. Often horse owners are allowed to buy the vaccines they need for other conditions and give the vaccinations themselves. So by having the vet administer the vaccine, that's part of the permit requirement, but it also means that it's seen as being a lot more expensive than a typical vaccination for a horse owner because you've got the call-out charges, etc. of the vet. Horses also need to go onto a register when they're vaccinated, so they wanted to keep a track of up-to-date vaccinations and the horses that were covered for Hendra virus for a number of reasons, partly for the permit requirement, but also so that vets can check up to see if horses are vaccinated fully, and event organisers can do the same. So if your horse doesn't have a microchip, it also has to have a microchip fitted. And of course, you can imagine that some people are a bit sort of sceptical and don't really want to go on national databases with their information. So that can be off-putting for some people. The vaccine is generally recommended for older horses, for horses aged 4 months older, and for pregnant mares. So it sort of covers a lot of horses. But if your horse is immunocompromised or sick, there's recommendations that you shouldn't vaccinate. So the vaccine has been available for about 5 years now, and although it's really hard to know exactly what the uptake has been, it is lower than expected or hoped for. So estimates are around sort of 10% in New South Wales and 17% in Queensland. One of the reasons it's difficult to be sure is because there's information about the number of doses that have been given to horses, but because of the number of boosters that they have to have, it's hard to know how many horses that are actually up to date fully at the moment. Some horses were vaccinated later and some earlier. Obviously, some of the hesitation around vaccination, is very similar to the sorts of feelings people have about vaccination for people, especially a new vaccination. So, there's concerns that it wasn't tested enough, that it wasn't safe, that horses were being used sort of as guinea pigs early on when not enough was known about the vaccine. And of course, people have been concerned about adverse effects. So, typically, horses like people will get sort of a bit of a sore spot where the vaccine was administered, maybe a bit of swelling, maybe a bit of temperature. That's not unusual. So those sorts of things are quite common. But other horses, or other horse owners have reported more serious adverse effects. And of course, this information gets shared and people get more concerned about it. And with the number of doses, with booster doses, I mean, some people, by the time the vaccine became an annual vaccine, had 7 vaccinations for their horses. The 2 initial ones plus 5 6-month boosters. So, as time went on, some horses became or appeared to become more sensitised or affected by the vaccine, and so people stopped vaccinating their horses or got very concerned. And the photograph that you can see there is a family from Gympie with Bella, the horse that was one of these horses that had its vaccination and sort of lay down and couldn't get up again, and unfortunately died a bit later, and they've attributed that to the vaccine, the family has. And of course those stories get shared on social media, etc. So, and other things that put people off include obviously the cost that I've said, the vet visits you have to sort of have those vaccinations administered, concerns about performance in terms of sporting performance, or horses that are stiff can be an issue for people who are in the equestrian sports that don't sort of want worried about how their horses move, etc. The over vaccinating I've already mentioned, and there were some early concerns about exporting horses that had been vaccinated, but that's less of an issue now. So, over and above some of the things I've just mentioned, there were some other issues that I thought I really should bring to your attention and that you should be aware of and consider. So the first is, some reasons people decided not to vaccinate was because they were concerned over compulsory vaccination, and that put them off. So although it's still an optional thing to do in most cases, certainly people who are pro-choice or indeed anti-vaccination wanted to keep that choice, and some of this led to a backlash, and sort of setting up of social media groups, influential social media groups like the one on the top left, who discuss this sort of aspect regularly. There's also this perception of pressure and bullying. So some people think that the vets are really pushing the vaccine. Others think it's the vaccine manufacturer who's perhaps behind a push to vaccinate unnecessarily. And associations may be pushed into this by insurance companies or wanting to influence their members in some way. So people are feeling that they're being sort of manipulated in some way, and kind of resent that sort of sense of being bullied. Importantly, this issue of beneficiaries. So this is around perceived conflicts of interest. So some horse owners, not all by any means, feel that the vets are the ones who are sort of benefiting all around from vaccination. So, they're making money out of selling and administering the vaccination, but also they're the group that's most at risk from infection. And because people who've been infected in the past have mostly been either veterinary professionals or they've been people very involved with horses and body fluids, they feel that they're not the ones at risk as horse owners, but they're being made to pay to sort of protect the veterinarians rather than horses or themselves particularly. And finally, use of PPE. So as you'll know, the Hendra virus vaccine is quite a fragile thing, and there's no reason to suspect that using PPE wouldn't be effective against Hendra virus, and the people who've been infected have not used PPE. So there is certainly a concern that if the vets would only wear the PPE, there'd be no need to vaccinate. So that's sort of certainly an opinion held by some people. Of course, vets, have got a number of reasons why they might be unwilling to wear PPE. Some are financial, around sort of the time it takes to put this on and the cost of it. Also, it can be quite uncomfortable in the heat and out in the field in the middle of summer. And others are more concerned about the impact that might have on horses, that they may be spooked by a vet in a visor approaching them, and they sort of kick out or injure them physically. So that's sort of quite a real concern. None of this was helped by prosecution of 3 vets last year by Queensland Work Health and Safety, who felt that these 3 vets who treated horses that were later found to have Hendra virus hadn't sort of taken adequate precautions to protect themselves and the people around them, and so they were prosecuted. And I think this was really quite an important turning point that affected that sort of veterinarian horse owner relationship. I'm about to talk about that more. So for the reasons I've just stated, that relationship between horse owners and veterinarians has been impacted, and partly due to frustration over the lack of vaccine uptake and the sense of feeling threatened by it. A number of veterinary practices have started to operate a no vaccination, no treat policy, a no vax, no treat policy, which means they're refusing to treat unvaccinated horses. And of course, this is causing concern in those areas, because horse owners obviously want to choose whether they vaccinate or not, and are concerned about being able to get care for their horses. There are also reports of occasional inconsistencies where vets have said that they will treat a horse if they can vaccinate it on the spot. And of course, things like that, those sorts of rumours get round and are seen to be ridiculous, because a horse isn't sort of safe just because it's just been vaccinated. So, some concern about that policy. Some practices have stopped treating horses altogether. And this has caused an erosion of that sort of relationship between horse owners and their vets. And the issue here is not just about Hendra virus. I mean, Hendra virus is obviously an important aspect here, but if we have a major emergency disease outbreak that involves horses, or indeed other animals that the horse owners have, the vets are the first responders, so they're the trusted experts. They're the people that the horse owners go to, and so it's really important that relationship is kept sort of, as a special relationship, as a trusted relationship. So the consequences of the no vax, no treat policy have been quite varied. Non-vaccinating horse owners obviously, can have problems finding a vet in their area, and that's a concern. Horses that are not vaccinated, that are sick, a vet may come out to treat them, but may insist on conducting a Hendra virus exclusion test to check whether the horse is free from Hendra virus. So that can take 1 to 2 days for those results to come back. It involves taking some bloods. And so horses are dying from sort of treatable conditions like colic because of this requirement to exclude Hendra virus as a possibility in the treatment. Another consequence of similarly is that dead horses may be left in situ until this exclusion test can be taken. So the photograph on the left there is a fairly recent story of a horse that was behaving oddly, bolted through these people's patio doors, smashed into that, died in their living room, and then the authorities wouldn't take it away until it had been tested. And so these sorts of situations, they don't happen often, but they get media coverage, and that obviously impacts on what people think about what the vets are doing and the way they're behaving, and that's not, of course, limited just to the areas where there's Hendra virus. So it can have an impact, I think, on the reputation of the veterinary profession in general. So you can see that there are mounting sort of issues on both sides. You've got the horse owners who feel that they're being pushed to vaccinate and do these other things, but that behind it is the idea that the threat of Hendra virus is hyped, it's overstated, it's not as prevalent or as dangerous or as likely to happen. So they're feeling a bit sort of pushed into one corner, and the vets on the other side are feeling that the horse owners don't understand the risk, or that they're ignorant, or that just don't want to sort of be agreeable about all of this. So in these last 2 slides, we've all been asked to give our expert opinions about the questions that you've been posed. And so I guess I should say at this point, I'm aware that I'm not a veterinarian. In fact, I think I'm the only expert talking to you who's not a veterinarian. And I've worked with horse owners, so I think it's probably up to me to sort of somewhat support the horse owners' side of this debate. I should also say I'm not a horse owner myself. I'm an animal lover, and I like nature and wildlife, so that's really where I come from. And so we were asked to consider, whether it's appropriate to rely on the behavioural interventions I've discussed here, or whether other strategies should be incorporated. Well, as you've heard, there's a number of reasons why people aren't doing the behaviours that are being requested to do, including vaccination. And so I think that is a patchy coverage for sure, and not something that we can rely on very, very adequately. I don't consider myself to be an expert on the culling or the ecological strategies here, so this is just my opinion, albeit perhaps slightly better informed than the average layperson. Culling and dispersal methods, I don't think they are necessarily that effective. I've only seen what I've seen in media. I haven't been part of any of these exercises, but dispersal, I think, just tends to move the problem somewhere else. There's nothing to stop the bats coming back to where they've been moved from. Culling, you're talking about large numbers of animals. You'd have to, I would imagine, kill quite a lot to have any sort of impact. So I'm not sure that I think that's a good route to go down. I can see why people don't want flying foxes around them when they've got a number of, thousands of them in their backyard or nearby. I can see how unpleasant that would be, but that's not about Hendra virus, that's about the nuisance. So I don't think culling's a great strategy. I think ecological strategies, as far as I understand them, are useful, but probably longer term things, and I think probably quite hard to show clearly what the advantage is in the short term. So I'm not sure that I can see much use for those other additional strategies in the meantime. And finally, I've been asked to comment on the question you've been posed around obligations of veterinarians and other first responders to respond to unvaccinated animals. So I think this is somewhere I have strong feelings. As you would have appreciated, I think the relationship between the horse owner and the veterinarian is extremely important, that the vet is a trusted source of information and has value in a lot of other contexts. And it's important for animal health that these relationships are maintained as far as possible. I think in some areas, certainly not everywhere, but certainly in some areas, the impact of Hendra virus and the strategies that have been taken, the no vax, no treat policies, I think have been extremely hurtful and damaging in that relationship. And I think in the context of a disease that's really nasty but fairly uncommon, is very rare, is it worth the damage being done to the relationship? Now it's not a simple problem, and that's why you've been asked to consider this. I think it's something that I think there's a lot can be done to make the discussion better between horse owners and veterinarians in this area. I do think we need to consider why people don't vaccinate, and I think respect and acknowledge their concerns as real, and not just throw more science at them. So I do think there's a lot of opportunity here for more dialogue to understand each other better. I think that people do think a lot about the risk of Hendra virus, and they weigh up the decision about the extent to which they feel their horses are likely to be impacted by it, and the costs, both financial and otherwise, of vaccinating. So I think people do consider that. A lot of people who don't vaccinate are concerned about the health of their horses, the age, etc. So there's lots of reasons why people might not vaccinate that are not about being anti-vax. It's not that simple. And I do think it's interesting when you think about other professions in the context of bad, horrible diseases and other hazards. So, the things that horse owners often say is that doctors in hospitals, dentists, they wear gloves and masks, and and they're exposed to far worse things or far more frequent sort of bad infectious diseases. Other first responders, emergency services, they do hazardous chemicals and things like that, and wear a lot of PPE as well. So I think on balance, I have a lot of sympathy with vets, but as I'm here talking probably more from the perspective of horse owners, I think better use of PPE and more sympathetic dialogue will probably go a long way in improving the situation. Thank you.